Hello, my name is Jesse. I'm a brain-spotting therapist. And today I'd like to share a little bit of my experience using brain spotting with others and the feedback I've gotten on how it works. We'll also talk a little bit about the research and evidence that we have so far with brain spotting and how brain spotting can be applied across cultures or even with folks who are neurodivergent. Brainspotting therapy is a newer approach to therapy. It does incorporate a lot of other established therapies within the brainspotting therapy. However, brainspotting itself is fairly new, and it's not as well researched as some more traditional, older therapies. There is, however, a lot of developing research occurring right now and in the recent past. For example, in 2016, amongst the Sandy Hook population, there was a study that surveyed folks who had been working with trauma related to the Sandy Hook shooting. And a lot of different therapeutic approaches were studied in this survey. Brain spotting was actually listed as the most effective approach to helping folks in Sandy Hook with their trauma, the distress and memories that they've had associated with that. And some of the more recent studies also show that brain spotting is effective with trauma, especially PTSD or complex PTSD. So while the evidence is still emerging and folks are still researching this, we do know that it has helped people with trauma, and it seems to be as effective, if not more effective, than some of the current standard trauma therapies. So I work with folks who have a lot of trauma. A lot of times that's the core issue that we're working on. So I use brain spotting frequently with the people that I work with. And I usually get positive feedback about brain spotting. A lot of times though, I get some really exceptionally positive feedback. For example, recently I was working with someone and she is recently in recovery with substance use and she's almost a year out. Over the period of time I've been working with her, it's been incredible to see her develop and to establish a relationship with herself again. One of the big things that came out in our work together is shame associated with substance use and also with trauma. And in a way, substance use is a trauma in and of itself. So recently when we were working together, we used a formal brain spotting session and the results were miraculous. She shared with me memories that she hadn't shared with anyone in over 10 years. They had been hidden away due to shame. After sharing it with me, she was able to go out and share with others, and her healing really just rocketed because she was able to share her story with others and process through with her friends and family, in addition to processing through with me some of these things that have happened and some of the shame that she's experienced. I had someone else that their issue was more related to kind of a phobia or anxiety related to airplanes and airports. And she was unable to get on airplanes without some really severe anxiety and panic. In fact, she would be worried the whole time in the airport. She would have to take multiple breaks. Sometimes she might need to take some type of medication to help her through her anxiety when she's flying. And when she would arrive at the airport, she would be stuck at the baggage claim until the panic and anxiety would subside enough for her to leave the airport. So clearly this was a big stressor in her life. Well, after working with her for 2 sessions, we were able to work on some issues related to that. And when I talked with her after she had returned on the airplane, she told me that she had no problems at all on that airplane trip. I have many stories like this working with folks using this method of working with trauma. And I found that it's been very effective, and the folks that I work with have benefited a lot. One of the things I love most about brain spotting is that it's a very flexible approach that honors where someone comes from, their worldview, their perspective on life, their perspective on mental health and recovery and healing, what that means to the individual. So as a brain spotting therapist, it's not up to us to decide what's right and wrong in terms of recovery and healing, or what should be talked about today in the therapy room. In Brainspotting, we really focus on staying in the tail of the comment, where the client is at the head of the comment, and we follow wherever the client goes, and we attempt to understand what's going on in a supportive and compassionate way. Brainspotting does not require that we talk at all in the session. Usually there's some talking, but that's not the primary thing that we're doing. Brainspotting incorporates all sorts of intelligences, not just talking and verbal communication. Brainspotting honors things such as spirituality, intuition. Brainspotting also focuses on our bodies and how our body responds to things, our emotions, our body sensations. There's a lot of mindfulness used during a Brainspotting session. And just like Brainspotting can be a very culturally humble approach to therapy, Brainspotting can also be accepting of folks with different brain types, neurodiverse folks, in that Brainspotting does not have a specific outcome or something to conform to during the therapy session. In fact, Dr. Grand always talks about how there is no assumptions, there's usually no homework, there's no fixing someone else, there's no teaching anyone else, and there's no converting someone to the therapist's perspective on what should be or what mental health is. So with all that in mind, I think it's a really great approach to work with folks who come from diverse backgrounds, different thinking styles, different mindsets, and different worldviews. If you would like to learn more about Brainspotting, feel free to reach out to me. My contact information is on my website, which is listed here and in the description, and I look forward to talking with you then. Thank you so much for watching this video.